There's something that I've been asking a few guests about lately, and you're someone who, as per your LinkedIn profile, says that you value candor above diplomacy, which I think is perfect for this question. And that is, what are we not talking enough about or taking seriously enough as a field in UX at the moment?
I think we're not talking one of the things we're not talking enough is what we mentioned earlier in the game, in the interview, is that our own well-being, right? And how to have those difficult conversations, how to navigate those conversations with customers and stakeholders, where we do need to push and press sometimes and go into the uncomfortable zone to get better insights, to get better. So I think there is a training that needs to happen there. I don't think we talk enough about research and UX in other areas of life outside of technology in broader sense. Like I'll give you an example is a couple of years ago, I was a program director of Interaction, the IXDA conference that happened in Seattle. And when we looked at submissions, there were a number of submissions that we decided we have to have as a theme. There were submissions from designers who work with terminally ill patients, like designing for end of life and death. And even having that topic on the conference agenda was the kind of knee-jerk reaction, this like, oh, do we want to talk about that? Okay, yes, we absolutely must talk about it. And it's the most fascinating topic or that session we had, because this is where things matter. This is where things truly matter, right? It's not just designing for patient experience, it's designing for end-of-life experience, in which case there are so deep ethical questions. Like we had a discussion with that is, are you designing for the one who is dying, or are you designing for the one who is living? Whose experience is that, right? Whose experience matters most? Or designing what happens that, with your digital afterlife and things like that. So I don't think we address those difficult to talk about subjects that are in dire need of our professional help. Yet on the one hand, that not many people go there, and we don't talk about it there, right? Because everyone feels uncomfortable. And I think we need to go beyond things that are comfortable and really purposefully look for those uncomfortable topics of the conversation to bring them up to the surface, to normalize them, and not just the surface ethics of AI and things like that. No, let's talk about deep ethics.